Hi everyone, I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. Today we have Albert here demonstrating the abdominal series. I have to give credit to my mentor Greg Johnson of the Institute of Physical Art for making this up. But this is both an abdominal exercise and a neuromuscular exercise. A great exercise to recruit those deep core muscles. Now that everyone has talked about this craze, this core craze. But to do it correctly, it's good to start with this. So with Albert here, what we're going to do, Albert, I'm going to have you create a little shelf or a tabletop with your legs. And the really important key here is to lift that tailbone a little bit. So you're going to lift it just a little bit. Now Albert, what I have you do is place your hands right here. What he's going to do is he's going to push and resist gently. I would say no more than like a pound or 2 pounds. And also lift the hand a little bit. So it's push and lift. And that creates a little traction. What you're going to feel is this abdominal muscle kicking right in. And what's going to happen there is over time you're going to start shaking. Shaking is normal. Shaking is actually your fast twitch muscle fibers, or what we call the phasic shake. And we want to blow past that. We want to get past that and get to the root of it, because your core muscles are endurance muscles. They're postural muscles. They come in way after all the shaking. So you do this until the shaking stops. So this is the first one of the abdominal series and the last step. So it's the first. We'll do another one in real time after. Thank you. Hi everyone, I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. This is the second segment of the ab series. Albert is here to demonstrate it. So we talked about in the first set that to push up and in towards the knees, and that's going to create that abdominal muscle to come in. So alright, Albert, I'm going to have you create that tabletop again. The second part follows right after the first part. So the second part, so we'll review the first part. So right there, we're going to put up and down. Good. Create that resistance. This muscle is going to kick in, and you do this until the shaking stops. It could take 90 seconds, it could take 30 seconds, it could take 3 hours. I'm just kidding. Hopefully it doesn't take 3 hours. But the second part of it is to cross the arms, and you're going to place them on the inner thigh. There you go. Job. And you're also going to do an up and in kind of push right there. Great. And you hold that. Once again, the shaking is going to start again. That's that poor neuromuscular control. Once the shaking stops, that's when you can switch to the third phase. All right, thank you. Hi everyone, this is Dr. Justin Lin of Rehab and Revive Physical Therapy. We're going to talk about the third section of the ab series out of 4. So let's review the first 2 quickly. Albert, I'm going to have you create that tabletop, lift that tailbone, and push up and in. After the shaking stops, however long it takes, then you create an X and you push on the inner thighs and go up and out. Very good. And the third part is actually to activate the back muscles right here, this multifidi muscles right in here that line your spine. The multifidi muscle is very important. Very important because they're the pillars for your vertebra, so gravity is not pushing down so hard. So you need those muscles to be kicking in. It's a very important postural muscle. So a lot of people with back pain, they have deactivated multifidi muscles. So we're going to try to get those kicked in. So this is how you start. This is the position. Albert's going to show you. What you're going to do is the leg is actually going to push towards out and down, kind of like this arc motion, this trajectory here. And with his hands, he's going to resist that motion. So go ahead and do that. You're going to do that kind of similar. The shaking's a little different, but there's still a little shaking. And you should feel, if this is the spine, the muscles on the side, they should kick in. And once they kick in, that's when you're done with that phase. Thank you. Hi, I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. We're talking about core muscle here. We're talking today about the ab series, and this is the 4th segment, or the 4th phase of the abdominal series, to get that core really kicked in for most of you individuals out there. So what we're going to do, we're going to show the first 3 phases again. Alright, so we're going to create a tabletop, lift that tailbone. Albert's going to push up and down. It's going to create that muscle coming in. You do it until the shaking stops. That's kind of our key to switch out of all these phases. The shaking's got to stop. So the next thing is to cross. That's phase 2. And you're going to hold that just as long until the shaking stops. After that is the third phase, which is using the multifidi muscles. So this leg is going to fight, your arms are going to fight this leg motion, this arcuic leg motion. And then the last phase is actually the first phase all over again. You hold it until that shaking stops. And so that's 4 phases for the ab series. Thanks to Greg Johnson, who's created this exercise.